Nurses are blowing the whistle on their exhaustion, warning of deteriorating services. The minister has brushed off claims as just politics as usual. Unions, though, describe the workload as like a war zone. Jonathan Lea has this story.
Short-staffed and exhausted New South Wales nurses are speaking out.
Very bad.
Very bad.
Every day double shifts, asking for overtimes, no proper staffing.
Is it worse than you've ever seen?
No, this is worse.
This is worse. How bad is it?
I can say very bad.
So in one word, how are the staff shortages?
Struggle.
The feeling amongst a lot of people that COVID is now sort of yesterday's problem.
Definitely doesn't feel like yesterday's problem in the health system.
Nick Howson works as a mental health nurse at Parramatta's Cumberland Hospital. It's beside Westmead. He claims continuing staff shortages mean mentally ill patients often receive inadequate treatment.
It's just ongoing. We've got so many episodes of overtime. For a hospital of roughly 400 staff, we've got nearly 500 episodes of overtime in 1 month alone. That means everybody's doing more than one overtime shift, and if someone's not doing one, like I personally don't do them because I have a young family, someone else is picking that up and working for 16 hours a day, sometimes twice a week, just to maintain the bare minimum of staffing that we're supposed to have.
The Nurses and Midwives Association claims over the last 2 years, fatigued staff have frequently been forced to decide whether patient A or patient B gets the proper care.
You know, asking someone to come to work and work double shifts 4 of the 5 days that they work and do that on an extended period and come to work and not be able to deliver the care because there's too many patients or there's not enough staff, it's creating a toll that we just don't understand. There's a lot of research about it now. It's called moral injury. We're asking people to do things that goes against their values, and they can't sustain that for a long period of time. It's the type of thing we see in war when you're asking people to go and harm other human beings.
I know there's an election going on at the moment, and perhaps the rhetoric might be getting a little bit to the extreme end, I think, when I hear comments like that.
No state is immune. Recently, Victoria was rattled by claims patients were forced to wait in tents for hours outside a major hospital. Queensland constantly pushed the Morrison government for more funding to ease ramping and surgery delays. Western Australia is facing protests, while ramping in South Australia toppled the Marshall government.
Let them say that we had a generational investment to ensure that when people call 000, the ambulance rolls up on time.
The desperate hope is that the worst is now behind our nation's healthcare system. It has been tried and tested like no period in living memory. But replenishing and replacing what has been exhausted will take not just more time, but money. And more staff too.
Nurses are hard to find. Nurses are resigning. In the United States, they call it the Great Resignation.
Critics argue New South Wales's hospitals have come to rely on surge beds, which they say amplifies the pressure on understaffed wards.
There's no funding attached to them and there's no staff attached to them. And so, yes, you can put a patient in that bed, but the quality of care that they're able to access is not at the standard that we would want.
We have almost a third of the state budget. We have more beds than any other hospital system in the nation. We have a huge health system and it's growing. Our government has spent more money on building new hospitals across this state than ever in the state's history.
The Perrottet government has the money on the table to attract more nurses. Along with those already brought on, it's announced an $883 million investment to recruit and retain regional and remote staff. The Health Services Union welcomes it, but plans to stump up $200,000 of its own money to work out where prior funding has gone.
We're seeing blockages in emergency, we're seeing blockages in diagnostics, we're seeing blockages in discharge, we're seeing blockages in theatre, recovery, right throughout the system.
Our hospitals are by far away amongst the best in the world.
With an election looming, the public will soon decide if the nation's biggest hospital system requires a political transplant or simply more time to recover. Jonathan Lea, Sky News.